Hey y'all, my name is Rosen, and as a nursing major, I just wanted to go over a common disease that nurses often see in the emergency room, urgent cares, primary care physician offices, as well as more often than not, we see this disease on GI floors in hospitals, whether it's a children's hospital, but most likely we'll see it in an adult hospital because this disease is often found in patients that are around 30-40 years old, typically is when it is found, but in rare cases we find this disease in patients on the adolescent side. So I just wanted to start going through some symptoms, treatments, interventions that we can do as nurses, and ways to make sure our patients are aware and educated of this disease that they might have. So first, the cause of Crohn's disease. One environmental cause that we might see of Crohn's disease is cigarette smoking right here on our concept map. So in their past history, if a patient is a cigarette smoker, this could be something that's pointing us in that direction. But more often than not, we're going to see that our patients have some sort of gene mutation. Most likely that they're going to have this gene passed on from their mother or father, and then this is going to lead to Crohn's disease. So Crohn's disease is an autoimmune disease of the GI tract, and simply put, this disease is caused by the immune system having an error in seeing the GI cells, such as the stomach cells, intestinal cells, as harmful. So these immune cells are going to start attacking it like it would any other bacteria or virus, but instead of it killing a virus or bacteria, it's trying to kill good cells in the body, causing those parts to become inflamed and causing lots of pain, especially in the intestines. So some symptoms that we might often see within our patients in the hospital that we need to look out for is loss of appetite, blood in your stools, fatigue, fever, diarrhea, weight loss, stomach aches, mouth sores. The common misconception that we see here is that this will be often overlooked, as some of these symptoms can be similar to that of a virus or bacteria, just normal illnesses that are often passed around in hospital settings. So we need to look at these symptoms carefully and ensure that we're pinpointing them and addressing them, especially if it's pointing us in the direction of an inflammatory bowel disease. Psychological symptoms such as stress and anxiety can often cause flare-ups. So if we see stress and anxiety in a patient with Crohn's disease, we're going to see flare-ups more often than in a patient that has Crohn's disease and doesn't have anxiety or stress. Or in a patient that has been put through a family emergency or just a tragic event, they may have a flare-up more often. Patient education. One thing that we really need to make sure our patients understand is that flare-ups are possible at any given time, and so they need to be aware of different ways to take care of that. So in a case of a flare-up, they need to come to the hospital. But once we have our patient in remission, we want to keep them in remission. And some ways to do this is by eating healthy foods that don't upset their stomach and exercising daily and ensuring that they're getting enough water. Some treatments, bowel resection, colostomy, and infusions and medications. This pyramid here shows the course of treatment for Crohn's disease. As we see this arrow goes up, that's showing the more severe the disease. And in that case, we're going to have a more severe treatment. So we'll start by treating them with antibiotics. If that doesn't work, steroids. If that doesn't work, immunosuppressants. If that doesn't work, biologic agents. And our last resort is going to be surgery, where we're going to either resect a portion of the bowel, as we see here, or put in a colostomy. And finally, just some nursing interventions. Make sure as a nurse that you are monitoring the intake and output of your patient. This can really help show the doctors the way that your patient is declining or the way that they're improving. And in the same way, we want to make sure that we're evaluating the treatment's effectiveness and their pain level. And in that case, we want to make sure that we're going to pick a new course of treatment if one treatment option is not working. So here's just a few basic tips for looking out for symptoms of Crohn's disease. This is a very important disease that can affect many patients in different ways, and it's often overlooked. So I hope this lesson helped in making sure that you know a little more about Crohn's disease. Thank you.